I'm Lisa Fitzpatrick, Associate Professor of Medicine at Howard University. I'm also the co-principal investigator of the Howard University Local Performance Site for the AIDS Education Training Center. Our biggest priority at the AETC is to identify district providers who may not be proficient in HIV testing, and we talk to them about various aspects of HIV/AIDS, but we mostly want them to test people for HIV because we're finding a lot of people late in disease who've had doctors and they've never been tested. So most of our focus is really on talking to doctors, primary care providers, nurses, even dentists and pharmacists, but mostly providers like physicians, to get them to test their patients for HIV. If we don't identify infections, we will never be able to control the epidemic. We'll never decrease the rates of HIV if we don't identify people who are infected. We can actually end AIDS diagnoses if we test and find people early enough. No one ever has to develop AIDS. So imagine if we could get all providers and people in the community to test for HIV. Oftentimes, as a physician, I would like to hear messages from my peers. And sometimes when the message comes from someone else who's not necessarily a peer, I won't be quite as receptive to it. And we talk a lot about how HIV testing needs to be routinely integrated into primary care practice. And some primary care practitioners, frankly, don't see this as something that they need to take on as an issue. They're already too busy, they're concerned about reimbursements, so we don't always get the receptivity that we want, because we may be seen as just coming in to give them yet another thing to do. But I would say overall, we have pretty good receptivity. Test your patients for HIV. Don't make assumptions about who's HIV positive. Don't think that your patients aren't the ones, because I'm seeing your patients. They're coming to me after being in care and they're being diagnosed with HIV. So test, test, test.